Welcome everyone to a brand new webinar with cosmetic laser dermatology. Today we are here to learn about the latest innovations in neck and jowl rejuvenation, including our brand new laser coring treatment. Dr. Kimberly Butterwick is going to give us all insight into treatment planning, recovery timelines, maintenance, and how results typically evolve with expert-guided care. And for those who don't know Dr. Butterwick, she is a world-renowned double board-certified dermatologist. She has been honored as a Castle Connolly Top Doctor for over 20 years and has been recognized by her peers with the prestigious Stegman Award and the Women's Dermatologic Society Legacy Award. Dr. Butterwick is recognized as an expert injector, from pioneering fat transfer techniques to fillers for beauty and shaping, advising major manufacturers and teaching worldwide. Dr. Butterwick is also considered a leading authority in anti-aging laser treatments, skin tightening, suture lifting, and sculpting the body with liposculpture and non-invasive body contouring procedures. And without further ado, Dr. Butterwick, take it away.
Well, thank you. And thank you everybody for tuning in tonight. I know it's cold and rainy. I guess there's nothing much better to do. So grab a cup of tea and we'll talk about what we can do for our sagging and aging necks. This cannot be just a problem of age, but we also see it in younger people too. So I'm going to tell you all about my favorite treatments. Now I'm trying to push the next button. Let's see if that's working. Let me try that. Oh, that works. Okay, these are some of my disclosures, but I've not been influenced in this lecture by any of them. So sagging of the jowls and neck is one of the top concerns of many of my patients. And it's really one of the first signs of aging. You can feel like the upper half of your face is okay, but the lower half is just having some problems. And patients often see the problem when they look down at a mirror and they get horrified by that. Or have you ever done this, taken a selfie of when the phone was on your lap and you see your horrible neck? Or someone sends you a picture thinking, oh, they'll love this picture, but all you see is like your neck looking bad. Now, a full neck, a double chin is very cute in infancy. And you look at a baby, they almost all have double chins and sagginess. So we like it in babies, but it's not so cute later. And this is often a family trait, the tendency to develop fat. So when I see younger patients with this problem, they often say, yeah, my mom or dad or my aunt or all my sisters, we all have this problem of this saggy neck. So it's not our fault. It's just a genetic problem in many cases. But in other cases, it's from sun exposure, where it's not just the saggy double chin, but it's the skin quality, the wrinkling, the aging, the discoloration. That's usually from years of sun exposure. And we all live in San Diego and love the beach, so this injures our skin over time. We often ignore our necks when we're thinking we want to fix ourselves up with facial cosmetic treatments. Like this patient, her face looks pretty good, but her neck shows her true age. Or I downloaded this from the internet. The next picture is a patient who's 92 years old, and she's had, facial lasers and taken care of her face. But look at that neck, just full of growths and discoloration. And we don't want to have a mismatch like that. So whenever you're putting your sunscreen on or your products on, do the face and the neck. Let's not ignore neck and hands for that matter. But the neck is very important because it's right next to our face. Otherwise, we'll have to be like Nora Ephron and feel bad about our necks and feel very self-conscious. She wrote this book in 2006 about aging women and how the things they have to do when these problems develop. Now, we could be like Jane Fonda. She doesn't like to cover up. She just fixes herself up in a beautiful way. And that has, I think, lengthened her career and kept her as a beautiful icon for all of us because, she's done some things, some cosmetic treatments, not just for her face, but look at her neck and her chest are beautiful. And so she's really an icon for us all. let's just have a quick anatomy lesson before we talk about what we can do. I'd like to look at the lower face and the neck and kind of define what we're looking at. We want the jawline angle you see here. We hate the jowls when they start to develop. There's a little dip in the side of the chin called the pre-jowl sulcus. The chin often gets sort of recessed, and ideally it would line up with the bottom of the lower lip. So if you want to check that, take a profile picture and see how far your chin projects. And then we like this angle, it's called the cervical mental angle, to be 90 to 105 degrees, not like straight down like 180. And sadly, we tend to lose that angle over time and develop these little jowls and laxity. So one of the things that happens is the fat pads that are in our face underneath the skin, they start to come down and sag. And that is really what the jowl is. In youth, it's kind of tucked in tightly just to the side of the mouth and chin, but it starts to fall down and hang down as we age. And nobody likes the jowl, and there's a lot of things we can do for that. Also, the bone is aging a little bit. The angle tends to change, and the actual jaw bone gets smaller as we age. We start to lose bone really in our 30s, 40s, but it gets pronounced after menopause. And so there's not enough bony structure to support the soft tissue, to support the skin. And so it sags even more. This is that jowl sagging, and it's falling, but part of the reason it's falling is it doesn't have the bony support. And we can see the chin retrusion here. And this sadly does happen to all of us, but there's things that we can do to keep it in line. The last area that I'm going to talk about today is this platysma muscle. We all have a nice muscle in our neck when we're young, and it just sort of drapes and corsets the neck for us. But as we age, it separates into bands, and it begins to sag, oftentimes in the middle. And this is what people call the turkey gobbler. And that's really, a lot of it is the muscle sagging. So there are some things we can do to slow down that sagging and try to keep it up. So what are the best treatment options for non-surgical rejuvenation and improvement, just beautification of that area? I'm going to tell you, we don't have time to go through every single thing. So I'm going to really kind of dial down to my very favorite things and things that I've personally tried. I'll even show you some pictures of myself, so that we can kind of talk about everything in a short span of time and still give you some time for questions. So ThermiSculpt laser devices with coring. We're experts here in lasers, and coring is our newest exciting thing. And lastly, I'll spend less time on fillers for lifting, shaping, and treatment of that muscle band. So by far the best treatment for the sagging of the jowls and the neck when there's fat sagging is ThermiSculpt. This is one of our signature treatments here at Cosmetic Laser Dermatology. It's a combination of monopolar radiofrequency energy combined with microliposuction. And you can see just this kind of a picture of the skin on the surface with fat, and this connective tissue underneath starts to sag and doesn't hold the tissue tightly anymore. So this little probe goes underneath and helps to tighten the fibrous septae and to melt the fat, and also heat the skin to have skin quality improve. This is a temperature controlled procedure where, as we're working, we have this camera aimed at the surface. It's called a forward looking infrared camera. And we want to keep the surface, the epidermis, at 40 to 42 degrees centigrade. And then the little probe that is right there has a thermometer at the tip, and we keep it hotter underneath to melt the fat and get contraction of those septae that I showed you. So we're tightening this, the fibers, we're getting new collagen new elastic fibers, melting the fat. So this will shrink down and tighten and give us a new contour. And I actually was the first one to present this and develop the addition of, I didn't invent the ThermiTight, but I did come up with adding a liposculpture, little micro lipo to take out the melted fat, because I knew that that would enable us to shrink wrap even better. And I even take one of these little baby cannulas and treat the jowl at the same time so that we can reduce the fat in that jowl that's hanging. All the instruments are less than a pen cartridge, not the big pen you see here, but the little cartridge underneath. So they're very tiny instrument. The nice thing about this is we just make a little tiny opening to enter the probe and the liposculpture cannula, that we don't need to put stitches here. These just don't scar. I've never had a patient in over, the 10, 11, 12 years that I've been doing this procedure. There's minimal bruising and no scars. We don't need general anesthesia for this. You could do it without any medication, but I think most people like to have a little Valium, maybe a little Percocet, just something so you feel very relaxed while we're working on it. And this is not our final result, but I wanted to show you in the next day when we take this little compression bandage off. You can't believe that it's that much better in one day with no surgery, no scalpels, no stitches, and this will continue to heal just beautifully. So who would be a good candidate for this? You're probably all checking yourselves. Do I need this? Well, we can do any age. We get good responses, older, young, male or female. We want to have some loose skin under the neck, some jowls if you got it. And if you can pinch the fat, that shows that you're a very good candidate for this. It's not as helpful if there's no fat under there, and we see only platysmal banding. Then we'll do something else. But part of the consultation process is, I'll take a good look at you and tell you, yes, this is the best thing for you. No, don't waste your money on this. But usually, if you think you need this, you do need this. And I'll just show you a few patients. This is a patient who, she might think, oh, I'm too old. My skin's not going to respond to this. But yes, you do get a lovely response with this, with good new jawline and structure. And the skin quality is better, and we've gotten good rebound of her skin. So you're not too old, and many people don't want to do a facelift. She won't have the facelift scars. She won't spend $100,000 like you might in today's facelifts or more. So this is more affordable and very safe. Again, no stitches, just mild sedation. And most people don't need any medication at all afterwards. Occasionally, we all have different pain sensitivities. So if you think you need medication, we give it to you. Here I took some microlipo to the jowl and the neck. She doesn't have nearly as much fat, but we got just a nice clean jawline, got that jowl. And again, this procedure, I should mention, lasts 5 to 10 years. The fat doesn't come back. The tightening really responds well. And so we did a study that was published, and when the neck, when we removed the fat, it was the best. It stayed away 9 to 15 years. So we're still going to age. The clock keeps ticking, but it is a long-term treatment, long-term result, and it's a one and done. You don't do 3 or 4 of these. Sometimes you might come in if you're in your 20s, early 30s, 35. You won't need the thermi. We can just get the beautiful tightening with lipo alone. This is one treatment. So we can get lovely treatments. This woman's maybe a decade or two older. has mostly skin laxity, but there is pinchable fat there, and we're able to get her a nice new contour. This is just 5 weeks later. Instead of the 180, we've got more of that 90-degree contour. And when we look from the front, sometimes there's a little fullness out in the jowl, and when I treat that, the face will narrow in a beautiful way. She doesn't have as many wrinkles there. So this is a nice treatment for someone who's in their 40s who doesn't really want to do a facelift yet. Maybe they'll do one, but it seems a little young to get a facelift. So I'm not against facelifts either, because that will be very, very tight and lifted. But the scars, the downtime, the expense, the need for anesthesia, that dissuades many people. Now, I've tried to postpone it as long as possible. Now I think maybe I won't need one. But we can get this. She does have that pinchable fat, start of a gobbler, and we get really a nice result here. Again, more beautiful results. So this is something that looks great. Usually there's a little swelling, so most of these I'm showing you about 4 weeks out. You saw the patient the next day. Let's see. Oh, there. And men do this too. Now he's got a really big neck, lots of fat there. And so with this procedure, there's some fat under the muscle. We can't remove that, but it's way better. He feels so much better than carrying all this around. And there was no definition at all under his neck. So without surgery, because men don't want the facelift scars that show, we can get a very nice result in men without any sort of surgery. This patient had some surgery, had some scarring under the neck, and had some fullness on the side and the jowl. And I will treat that fullness with microlipo, treat that jowl. He's only 3 weeks, so this all is going to still tighten up. Many patients come in from out of town, so we don't see them again for a while. Again, here's a patient who didn't want a facelift, had a big neck, no definition from the face, like we like to see the jawline, but now she's got a nice shadow there. She's got a much better angle. She looks actually just probably like her daughter, not like the mother anymore. So it really makes you look much younger to get rid of this neck problem. This patient had recession of her chin as well as the fat there. So we take some fat and we can put it in the chin to kind of push that out to elongate the chin and get a better jawline. We actually put a little fat in this area as well. And you can see we get a lovely result with different combinations. We can do that with filler or fat. And one of my favorite combinations here, she had lots of photo damage on her face. So she had the Take 10 laser. She's still healing a little bit. These spots will continue to fade, and the Thermi at the same time. So she's got a new neckline, new skin, tightening around the eyes. Just beautiful response without surgery. Now, so that's the ThermiSculpt. That's a great treatment. But sometimes the problem is not sagging, but it's really the skin quality and the way the skin looks. And so here we see something that's called poikiloderma of Sabat, the red skin, and it's a little bumpy. With an ablative fractional laser, this is actually the Fraxel Repair CO2, we can get that quite a bit tighter, and we use IPL or V-beam to get the redness down. So at the same time, she did have the laser to her, CO2 laser to her face, but when we do the neck with a CO2 laser, we have to turn it down because the neck won't heal that well. It doesn't have oil glands and hair follicles, so we have to be gentler on the neck than the face. You see here another beautiful result with the Take 10, the tightening, just brand new, wonderful skin. And we all love that and just wish we could get a little more tightening but we have to turn the laser down for that. So this is the type of neck. We got it better, but we still want more, of course. But if I turn the laser way up, like I can do for the face, you're going to get scarring, you're going to get blotchiness, you're going to turn white. It's not going to look good. So that's why I'm really, really excited to introduce to you today the UltraClear laser. This is a newer laser. It was FDA cleared in 2023, and it does something that other lasers can't do. First of all, the laser comes out in a little tiny cylinder, tiny ray, sort of microwave of a laser compared to a regular erbium and a CO2. So they divide the laser beam into tiny little fibers, which makes it gentler. It's an erbium laser, which means it doesn't have a lot of heat, so it's gentler than a CO2, so we can use it safely on the neck. But we can add some heat, a little bit of heat around these rings so that we get tightening. A regular erbium often doesn't have heat. So it's less painful. It heals more quickly because of the small spot size, the increased number of channels per surface area. I won't get too technical, but we can do a lot of things with this laser, including going deep without any heat with this laser coring. And so the coring is what I think is really going to be a game changer for the neck, where we can sort of drill down with this laser and actually remove a little cylinder of skin and shrink the surface area. And I've got a good video. Let's see if it'll show in a minute. That's laser coring. And we often combine the coring with some laser at the same time. There's a device out there that can do mechanical coring, but the hole is a little big and it can scar. So the laser coring is a little narrower and safer and quicker to heal. Now let's see if our video will show. Yeah, so here's how the laser works, the little cores, but you can kind of combine the cores so they drill down with a very narrow cylinder. And as that heals, it will shrink the surface area and heal without scarring. So this is a patient from the company's information on how it looks day 2, but it heals fast because there's no heat. I tell patients it takes about 5 days to heal. Now, I wish this patient would probably needs a facelift to get her neck all the way up, but she doesn't want to do that. She might be unhealthy, so we can get a nice tightening there. And when I saw these kind of results from the company, I thought, I need to do this laser. And I talked with some friends around the country who are really loving this laser coring. So this is what it looks like if you just do cores alone. You see little tiny dots that can heal up in 5 days. And so we begin to work with this. This is Dr. Cream. Sorry, I didn't tell everybody your name. And she barely has any aging, but we did some coring around her eyes, and you can see lifting of the eye areas. She had creases here, and now it's much tighter. So we did a very light coring to her eyes, but now I'm beginning to do the coring around the mouth, and you can see tightening of that jowl. It's much better tightening of the whole neck and quick healing. So this is a nice way if you think I need to quickly help my neck. Now this is a very difficult patient. She has a little laxity here. She's got some lines that show, and guess who this is? This is me. So I was working with this laser, and I told my fellows, let's do me. And we have 2 doctors who do a fellowship with us every year. And I drew out a map and told them exactly how to do it. And while I was getting it done, I was talking to them, lightly sedated. And here I am tightening this these fine lines here with coring on the upper lip to tighten, and the neck is way better. I've done a lot of different treatments here, and I haven't seen that degree of improvement with just one treatment. So I think laser coring is very exciting, and you may be a candidate for something like this. We also cored my forehead, which I think really lifted and improved the skin without too much healing and no prolonged redness. So this will be a very nice addition to our laser family here at Cosmetic Laser Dermatology. Now, if that takes 5 days of downtime and you look awful, if you don't want any downtime, or if we're in the maintenance phase, we have a lot of energy devices that give good tightening. Thermage for the full face. Potenza has radio frequency micro needles that go into the skin and tighten. I love this for acne scars and the crinkly neck skin, arms, other areas where there's laxity. TriLift is a new one that tightens the muscles of the face. It's not for the neck, but for the neck, ultrasound and radio frequency are great. Ultherapy is a tried and true method. We have the newest device in Ultherapy, and SoftWave is another very safe ultrasound. All of these devices stimulate our fibroblasts. Those are cells, and if you heat them and stimulate them, they will make more collagen, more elastic fibers, more hyaluronic acid, and connective tissue. So the fibroblast is very important to our skin quality. And everything that we do, whether it's laser or energy, is to get these fibroblasts to make more collagen and elastic fibers. We even have a new skin cream called ReQ that I'm using that teaches these cells to respond more readily. This is a patient who doesn't need a whole big procedure, but has a little laxity under her neck. She did well with the ultrasound, just one treatment to the upper neck. The SoftWave is another ultrasound that is parallel waves, and it's a very superficial one. So it helps people that have very thin skin where we don't want to lose any facial fat to tighten the face and the neck. This usually takes 2 treatments a month apart. So energy devices have no downtime at all. So the next day you can be ready to go, but they take longer to see the result. So that's the benefit of ThermiSculpt or laser coring. If you're in a hurry to look good, then you would choose something like that. But if you want to kind of go the slow and steady route, or it's not too bad and you want to maintain what you've achieved, then you'll do one of the non-invasive tighteners. This is one of our staff, my beloved nurse Isabel, and she had the Thermi 5 years ago. We've done some fillers to lift her cheeks, and she's done some our newest device, ThermiTight, that tightens the cheek here, which actually helps to lift the neck too. So in 5 years, it's nice to know you can look younger, you can look like yourself, you don't look like a surgical person, and you can kind of keep improving things as time goes by. I'm now going to mention some of the easy treatments that can be done just with a simple office visit. We do Botox, Dysport, Daxify, Xeomin. These are all neurotoxins that can be put in this muscle. So why would a neurotoxin work in the neck? It's because these bands are muscles. She's not a candidate for the ThermiSculpt. She has no fat and has only these bad muscles. Once these muscles get really bad, you wind up having to get surgery. So that's why you want to try to kind of keep up with it and maintain this with some Botox right along, or any of the neurotoxins, Dysport, Daxify, all along these bands, and it makes them lay down and not be so tight. in youth, you can see again that muscle comes up and it actually comes up and over the jawline. In youth, it just kind of keeps our neck tight, but as we age, it starts pulling down. This muscle is the biggest depressor of the face, so it's pulling our faces down. And when we treat it, your not only does it help the neck look better, but the face actually lifts up. So it's Botox Dysport. That's an easy treatment in the office for the glabella lines, for the angry lines here, or the crow's feet, but it's also an easy treatment for the neck. And if you wonder if you need it, you can just kind of grimace and make that face. And if the bands kind of stick out, then you're a good candidate. So when we use neurotoxins for the neck, it can also help the bands, which we've talked about. That was approved by the FDA in 2024, but we have been using it off-label in the neck for a good 10 to 15 to 20 years. It's been widely used for many years. But more recently, the Nefertiti lift has been used where we put little dots of Botox along the jawline, above and below, and that can give you some nice definition of that jawline. You can create more of a shadow and it won't pull down on the face as much. So this is, again, a great easy treatment, the Nefertiti lift. And sometimes I see the platysmal muscle is just bunching the skin, and we can do a micro droplet technique. I take the usual dose and dilute it by half and put little tiny dots all over the neck. This was first described by one of my lovely colleagues in Brazil, and it helps the neck quality. So if you don't want to do lasers or devices, this can also help the skin look better, little tiny dots of Botox. And here we see the jawline just improving and lasting, 180 days, or Botox usually lasts about 4 months, generally speaking. So now another easy treatment that's done in the office every day, and I've done this all week already, is use fillers. Now you might think, I don't think of fillers used for the neck, but we really can help both the jowls and the neck. Sometimes we put fillers directly into a line. Sometimes we take the biostimulatory fillers all over the neck. And sometimes we just add structural support to that jaw line that I showed you earlier. When we lose our jaw, the skin falls into the neck. So that's how we help our neck, by supporting the jowls. Now, tech neck, if you Google this or look on social media, you'll see all sorts of things about tech neck. And it's really because nowadays everybody looks down at their phone, and we're seeing women in their 20s and certainly in their 30s with lines, horizontal lines along the neck that seem to be developing premature to what we would have seen before we all looked at our technology so much. So many women hate these lines that are starting to form because of looking down so much. So what I do is but we use a lightweight filler, so if there's a little bump, I can just press it down, and just one syringe diluted down. I can usually do the main horizontal lines in the neck with just one filler. And here she is later, and you can see much improvement in those tech neck horizontal lines. So this will last. Actually, we usually last close to a year, and it can help ward off those lines. So I think it can slow down aging. Maybe we put a little bit of diluted Botox along those lines at the same time. so there's less pull. And this is a nice treatment for early aging of the neck. Now, sometimes we do biostimulatory fillers to the full neck. This is something I demonstrate at conferences all the time. Diluting down a filler called Sculptra or Radius. These aren't really fillers, they're teeny tiny little particles that we dilute way down, and they stimulate those fibroblast cells that I showed you earlier. So there's Sculptra, and now what I've been doing is mixing Sculptra with a little bit of a hyaluronic acid so it's even smoother and we get the result faster, because this can take a while. We usually we dilute down the radius. In this case, this is an article that I review with other doctors where we dilute it down. We can place the product in with a cannula, and after 2 or 3 sessions, the neck will get a little bit of volume and it will improve. But it does take 8 months, even up to a year, to see the full benefit of this. So this is a great treatment. There's really minimal downtime, very few side effects, but you can occasionally get a little bump from it. And so there's different, you can use a cannula or you can use, this is my friend from Brazil, Dr. Almeida. She likes to use a little needle there just to help get more collagen and elastic fibers, get a thicker skin, because our skin becomes as thin as paper as we age, and we don't like this. This, I didn't have a good photo off last night as I was looking, putting this together, but we do the chest all the time, and we can really get neck and chest, these fine lines, and the skin quality much better. Never had trouble with this. And then lastly, so I don't take too long, put you to sleep, and let us have time for questions, I'm just going to quickly talk about facial shaping to improve the jowls and neck. And this is something that is very important, because when we see each other, our brain tells us things about each other that we're not even aware. But when we look at someone's facial shape, when we look at the jawline, we assess beauty, trustworthiness, age, and gender. So the brain just assesses in 30 seconds or 33 minutes how many things about you just by looking at the jawline. A defined jawline and chin signifies strength, success, attractiveness. So that's why it's kind of important to take a jawline like this that's gotten smaller over time and balance the face with some filler. We widen the face, widen the jawline. We put a little bit of filler under the eyes, and we can pick up some of the laxity of the neck. And I'll show you the side view just by adding some to the jawline, pushing out the chin a little. With this is 2 fillers, we're able to get some nice improvement in that cervical mental angle, and certainly help the face look better at the same time. So sometimes if you've got like a wedding in 2 weeks, we don't have time for laser, but we can put some nice filler in. And don't be afraid of laser, of fillers. If it's done well, we're not going to overfill you. This patient had a very full face. You might think she doesn't need fillers, but when we do fillers, lift up, do the perimeter, help this jawline, we actually lift up the neck. This is right after, because you can see she's got a little bit of bruising there. Place the filler in key areas, help the shadowing. We really make the face look slimmer and better. She doesn't look like she's had fillers. She just looks better. So that's what we can do with our expertise and experience, and get some lovely results for you, whether you go the slow route, the fast route, whether you're afraid of needles or not, or pain or not. We can really fine tune and customize a treatment that is just the best for you. I personally like the fast way, so I love the coring, but I also use the neurotoxin on my bands, fillers now and then for shaping, certainly. And I've had the big laser back in the day. One thing I have not needed this ThermiSculpt. That's something sort of genetic. Either you have that problem or you don't. And it doesn't go away. It tends to get worse. But that is really such a powerful treatment that I can't emphasize how safe and how good that treatment is. So now we've sunsetted our lecture for now, and it's a beautiful sunset in La Jolla, but I don't think we'll see our sunset with the rainy week we've had. And I thank you all for listening. It's a good evening to stay indoors, but hopefully we have a few questions and some time to answer in the next 15 minutes or so.
Great. Thank you so much, Dr. Butterwick. Alrighty. So before we get into the Q&A section, I just wanted to let you know that we do have an exciting promotion tonight. While I'm letting you know about the promotion, please feel free to ask your questions. But today's promotion for watching the webinar, the first three attendees to book a neck treatment with Dr. Butterwick will receive 15% off their treatment, plus receive a complimentary skincare basket. And the treatments must be booked by March 31st of 2026. I have just put a link in the chat. So if you click on the chat, you can see the link and it will lead you to a form. If you fill out that form, we will collect your information and we will reach out to you as soon as we can to get you scheduled. And hopefully you will be one of the first three to claim that promotion. So make sure you click on the form and fill that information out. And then otherwise, if you'd like to schedule an appointment with Dr. Butterwick moving forward, you can go to clderm.com and simply call us and we will get you scheduled for a consultation. All right, so moving into the question portion. So the first question is, can you have ThermiSculpt if you've had filler and Sculptra?
Yes. The question, can you have ThermiSculpt if you've had filler and Sculptra? And certainly yes. That's not a contraindication. Um, and it won't really make the fillers go away. It wouldn't be in the same area. So that's very safe and fine to do. In fact, we actually sometimes call it the ThermiSculpt³ because we might at the same time add a little filler to the jawline or add a little um, Botox or neurotoxin at the same time to get a nice result.
Awesome. Okay, so our next answer question is it best practice to do regular neurotoxin for platysma bands after getting ThermiSculpt to help maintain the neck?
That's a good question, and I would say yes, because um, we know the future of that muscle is to begin to pull more and more on our faces. If you're young and you have your full bone structure, you probably wouldn't need to start in on the neurotoxin to your platysma bands yet, but many patients do have those platysma bands maybe starting about in the 40s. I rarely see it younger than that, but sometimes. And so when we start to see them, when we start to see the pull down, that's the time to start. And if you don't have very significant banding, then we don't need as much. If you've got a full neck full of bands, then we need more. And sometimes I see young women with really big bands, and I ask them, do you do pull-ups? I think I can't do one pull-up. I don't know. I'm not that strong, but how about you? Can you do any pull-ups? Yeah,
Yes. Yeah, a few, only a few.
I think develop those bands too thick, so don't do too many pull-ups.
Heard. Okay, so our next question is, what does the downtime look like for ThermiSculpt?
Very good question. The downtime is you need to take a long weekend, because one of the things about it is after we're done, we put an elastic strap around your head. So that looks pretty goofy, and we like you to wear that 24 hours a day for 3 to 4 days. And I would instruct you whether I think you need to wear it 3 or 4 days. So during that time, you pretty much keep it on. It just looks like a big elastic strap, and it's hard to hide, so you wouldn't go out to the grocery store or anything. Maybe on the third or fourth day where you could take it off and go out and do an errand and come back. But that's the main downtime. Usually we see very little bruising, but bruising, you can wear a turtleneck or a scarf and hide it. And we do offer complementary treatments for bruising no matter what we do with our pulse dye laser. So we can help the bruise go away. There's very little bruising. What happens that first week is there's a little bit of swelling. So the day after I showed you a picture, it looks like it's practically fixed. Then it'll swell a little bit. And a week later, it looks a little better, but not as good as it did the day after. So it stays a little bit swollen for that first month. But the tightening, it keeps tightening for up to 6 months. So if you have a wedding next fall or next year, it's good to do it. The sooner you do it, the longer you have to see the full result. But you want to give yourself at least a month before a big event like a wedding.
Great.
You can go back to work on the 5th day, I would say.
Awesome. So somebody asks, if you have an enlarged thyroid, can you still be a good candidate for any of these treatments?
Probably so. We would feel the thyroid, make sure you saw your doctor, your endocrinologist to see what it is. But the thyroid's lower and certainly a lot deeper than the fat above. And there's no danger to underlying structures below. So we might have you check with your doctor, but yes, you most likely will be able to have the procedure. Before we do our bigger procedures, you have a little phone pre-op, and we make sure that you're healthy, that we have medications that we sometimes use, and we get all our ducks in a row so that we know how to take care of you and prevent any side effects to make you comfortable. So that's the benefit of our practice. We really do know what we're doing.
That's great. So the next question is, I'm 85 years old. Am I too old for treatments?
Well, I showed you the 68-year-old, and I will say this past year in 2025, I did more people in their 80s than I ever had. The thing is, we're living longer, we're living fuller lives, we're active, and in your 80s, you still want to go out and do things. And if you start to feel embarrassed about yourself, you tend to isolate yourself, which isn't good. So the thing about the ThermiSculpt or some of these other treatments, we don't need general anesthesia. So that takes a concern because, as you age, you hear general anesthesia might affect your memory to some degree. So we need only light sedation. We're not cutting, we're not getting into deeper structures. So when we stay within the skin and the fatty tissues, it's a superficial treatment that's very safe. Now, sometimes if you're like some of those pictures where there's a lot of laxity, we're not going to get it up fixed like you're 30 years old, but it makes you feel better just to get some degree of nice improvement. So you're not too old. Um, so if you want to do something for yourself, you should do it.
Great. All right. So another question is, I just had mixto laser on my neck 3 months ago, and my neck looks more lax with lateral laxicity lines. Would you recommend filler for next step?
Yeah, if you just had a laser and it didn't do very much, or it seems more lax, um, that's not good. So we'd have to see you to evaluate you. Do you need jawline filler? Is your chin recessed and we can lift it that way? Maybe the bands have become more prominent. Maybe you actually need something like laser coring to remove some of the skin very subtly. So uh, there are things that can definitely help. I don't know why you would have felt more loss of laxity. The lasers should help collagen, help elasticity, and maybe it went too deep and damaged some of the fat. Because we on the neck, we really want to keep the fatty tissue, or that skin will just get too thin. So to answer that question, um, yes, there's something we most likely can do, but I would have to evaluate you to see what the best thing is.
Great. So another question here. Can you have ThermiSculpt if you have had cool sculpting on your neck?
Yeah, cool sculpting is a way to freeze the fat under the neck, and it's pretty good. It can be effective, but not. It can remove about 25% of the fat. When you've had a procedure under your neck, whether it's a facelift, liposuction, or cool sculpting, there'll be a little bit more fibrous tissue. And so when I do patients with that, we certainly can do it. Um, we just, we can do it very safely, but there's a little fibrous tissue that we have to fight. But I will win that battle. And we have to watch the temperature even more carefully. When we're doing the thermi, the room is very quiet. Two nurses watch the temperature on one screen, and me and my assistant watch the temperature underneath. So it's very controlled, and it makes it a very safe procedure. You probably have a little bit of fibrous tissue, but you probably have some fat because the cool sculpting just doesn't remove all the fat. So thermi um, is a really great treatment for you. And I showed a patient who had even a facelift that we can do. So if there's a problem there that I think is amenable to the thermi, like some fat or laxity, certainly you can have it.
Awesome. So somebody asked, do you use intraocular eye shields for thermage around the eye area?
Yes. Sometimes we do thermage around the eyes, and it is absolutely not safe to do unless you do the intraocular eye shields. Now, that's a little scary for patients to get the eye shields in, but we have some techniques, and we can sedate you if we want to. So we do put those eye shields in so that your eyes are super protected at all times. It's very important that the eyes are protected.
Awesome. So our next question is, they're coming in quite quickly. You mentioned great treatments for skin laxity of arms. Could you discuss this a little bit?
Yes, for arms, sadly we get laxity, particularly after menopause, all over the body, but the arms right in here can be and you bend your arm and you see all this crepey skin. Nobody likes that. And there's some very good treatments. Often will use a combination of radio frequency microneedling with a potenza and a fraxel laser at the same time to get the maximum tightening with a procedure. And we can use some, actually, if I often use either Sculptra or diluted radius in the arm. If I feel like there's a lot of sagging, I like Sculptra as sort of a glue to all around the arm to kind of keep that skin tight. If it's more just really bad skin quality, I might choose the radius dilute in the arms. And it does take a lot of treatment to get that arm laxity tight. Usually 2 or 3 treatments a month apart. And then we just do a maintenance once a year. There's some good arm tightening creams also. I like the ones by Skin Medica and also Elastin. Even CeraVe has a new body tightening cream. If that's easy on the budget, just go get some of that and start. Everybody who's aging, start in on some tightening creams because you want to try to keep that skin as tight as you can. And then we start in on procedures. Usually those devices I mentioned, and sometimes we also use the ultrasound on the arms. Either Softwave or Ulthera can be used. The Ulthera actually recently had the FDA approval for the arms, and so there's lots of different devices. Depending on the problem is how we decide which of our devices is best for your arm. Some places only have one type of device, so that's what we'll use. And there's an old saying, if you only have a hammer, you try to fix everything with a hammer. But we have so many tools, we can cherry pick the one that's the very best for your situation that will be the most effective in the fewest treatments possible.
Awesome. Okay, so our next question is, do you perform My Elevate? If so, what are your thoughts on that procedure?
Um, I was interested in My Elevate and I had them come down and look. That's a procedure where they take a permanent thread and they sort of lasso those platysma bands and then anchor it back. It's a big procedure. It can make it hard to move your head for 6 months. It's the threads are permanent, so if there's a problem, it's a little tough. I decided it wasn't in the realm for me as a cosmetic dermatologist. There are some plastic surgeons that do it, but don't go to a spa and get something that invasive. So that's a pretty invasive treatment. I do like the outside threads, and the ones I like are the silhouette threads. And I love to put them all along the jawline and anchor behind the ear. And sometimes I do micro lipo at the same time. And that is a really nice, quick treatment for the jowl and the neckline. I found that to me, the threads are really great in the face and great for the jawline, but not so effective in the neck, in my opinion. So I tend to choose, especially because I've got ThermiSculpt and now I've got laser scoring. So I think there are better treatments.
Awesome. All right, we still have quite a few questions. So any questions that we aren't able to answer, we will work with Dr. Butterwick and hopefully we can film a quick social media video and address the rest. But we have time for just a couple more tonight. Um, Another great question is, does laser coring help with platysmal bands?
I'm sorry, I interrupted. What did you say?
Um, does laser coring help with platysmal bands?
um, Only in the fact that it'll tighten and lift them a little bit, but you still need to do the Botox along with it. So we're not going deep enough to cut into the muscle there with the coring. And so, no, we do usually, if you've got bad bands, it will tighten the skin and make them look less shadowy, like some of the pictures I showed you. If the skin is tinted around the bands, they look better, but I would still advise to do a little neurotoxin in those bands. What I was saying is, you, the audience, you're asking great questions tonight, and I love your interest and your focus. It's great.
All right. So one more question for the evening, and make sure to check social media in the coming days. We'll likely have some stories, and we can add it to our collections. So stay tuned for that. So the last question of the night is, do you recommend all therapy for the face?
Yes, I often recommend therapy for the face. It is one of the nice, non-invasive tighteners for the face. And where I I think it's really strong is the forehead because many patients as we age, the brows start to go down and we can't use our Botox or the brows fall down more. So it can tighten the forehead. It's a great way to tighten the cheeks and the neck as well. Um, it's able to go deeper than some of than the software, for example. So for some people like me, I'm thin at the side. I might choose software for the sides, but Ulthera for the forehead and for the neck. So I've done both of those over the last probably 20 years because just kind of rotating through different modalities, sometimes doing the non-invasive, sometimes doing lasers, doing fillers. If you do kind of rotate and every year do a little something different, then no one thing will be overdone and you'll age naturally and gracefully. I think the Ulthera is a very strong tightener. Um, but for like the skin quality, I think then we need to go into lasers or radiofrequency microneedling for that really crepey skin or acne scarring. So each device has its strength and weaknesses. Mhm.
Amazing. So I have put the RSVP link for our next webinar in the chat, our Instagram link in the chat, and most importantly, request an appointment link in the chat. So make sure you fill that out and we will reach out to you as soon as you can. Um, and if for whatever reason you're having trouble accessing the request an appointment link, be sure to call us first thing tomorrow morning at 9 a.m. and let us know that you watched Dr. Butterwick's webinar, and we will get you on the list. Additionally, we'll be answering the questions we weren't able to tonight, hopefully on Instagram. So I've pasted the Instagram link in the chat. Make sure to follow us on Instagram if you aren't. We post updates. We have informational videos from all of our board certified dermatologists, some really great content, and hopefully we'll have the rest of these Q&A questions answered as well. And thank you so much, Dr. Butterwick. This was wonderful, and we hope to see you all in the office very soon.
Mhm. Thank you. Thank you, everyone.
Thank you. Bye-bye.